I is for independence. This is the ABCs of Caregiving. Hello, everybody, and welcome back to the ABCs of Caregiving. Today, we have made it to letter I, and I is for independence. Before we get started, I want to share this important disclaimer. This video is for educational and information purposes only. It is not intended to provide medical advice, diagnosis, treatment, and it should not replace the advice of your physician or any other qualified healthcare professional. Every person in caregiving situation is different. Individual needs may vary. Always consult the appropriate healthcare professional regarding the appropriate questions or concerns about your specific situation. Now, let's talk about independence. One of the greatest gifts we can give an aging parent or someone we're caregiving or caring for is the opportunity to remain as independent as safely possible. Sometimes when we become caregivers, we want so much to help that we're doing everything. We cook, clean, get their clothes, answer questions for them, make their appointments, organize their medications, speak for them, and we start doing things that they still may be perfectly capable of doing themselves. And we do it because we love them. But sometimes helping too much can unintentionally take away something that's very important, their independence. There's a Bible verse I want to share today, Galatians 5:13, and it says, "For you were called to freedom." That word freedom is so important when we talk about caregiving. A person may need assistance, but they still deserve choices. They may need supervision, but they still have and deserve a voice. They may need help, but they still deserve dignity. And they may be getting older, but they're still an adult. Their age does not erase their identity. Their diagnosis does not erase their personality. And needing assistance does not mean that they should automatically lose control over every part of their life. So, caregivers, here's one question I want you to start asking. What can they still do for themselves? Not what can I do faster or what's easier for me, but what can this person still do safely? Maybe mom can choose what she wants to wear. Let her choose. Maybe dad can still make his own sandwich. Let him make it. Maybe your loved one can still brush their own teeth, comb their hair, feed themselves, fold towels, water the plants, or help decide what's for dinner. Those things may seem small to us, but they can make a huge difference in the care the person is receiving because their independence gives those people a sense of purpose. It gives them confidence, it gives them control, and it reminds them that, hey, I still matter. Let me give you an example. Imagine someone has been dressing themselves for 70 or 80 years. Now, someone walks into the room, they pick out their clothes, put it on for them, fix their hair, and makes every decision without asking. How might that feel? Even when the caregiver has the very best intentions, the person receiving care may feel like the control over their life is disappearing. Here's another way. Instead of saying, "Here, let me do that for you," try saying, "Would you like some help?" Or, "Which part would you like to do yourself?" Or, "Would you like the blue shirt or the green shirt today?" Or simply, "What would you like?" Those little choices matter. Here's something caregivers need to remember: independence does not mean doing everything alone, and that is important. Independence can mean participating in your own care, it can mean making choices. It can mean doing part of a task while someone else assists in another part. For example, your loved one may not safely be able to stand for long enough to prepare a whole meal, but perhaps they can sit at the table and help prepare ingredients. They may not be able to do an entire load of laundry anymore, but perhaps they can fold the clothes or match socks. They may not safely be able to walk through a grocery store, but they can still help make the grocery list. Participation matters. Now, of course, we always have to consider safety. There are times when abilities change. Someone may experience weakness, mobility problems, memory changes, vision changes, balance issues, or other conditions that may affect what they can safely do. And this is why caregiving is often about finding a balance between safety and independence. We don't necessarily want to restrict someone, but we also don't want to ignore genuine safety concerns. Sometimes the answer is not taking the activity away. Sometimes the answer is simply modifying the activity. Could this person sit instead of stand? Or could you place commonly used items within easier reach? Could you provide better lighting? Maybe remove some clutter or provide an assistive device recommended by the appropriate professional? Could you provide supervision without taking over? Hmm. How can I make this activity safer while allowing this person to still continue participating? Well, that one question can completely change the way we provide care. Another important area of independence is decision making. Whenever possible, include your loved one in the conversation about their life and care. Talk with them, not simply about them. Ask them what they like or prefer, what's important to them, and when appropriate, give them time to answer. Sometimes caregivers become so accustomed to answering for someone that we forget that the person has an opportunity to speak. Pause, give them time, listen. Independence is closely connected to something we talked about earlier in the series, dignity. And dignity is not something people should have to earn, it belongs to them. Here are a few simple ways caregivers can encourage independence. Allow choices whenever possible. Encourage the person to do what they can safely do. Avoid automatically taking over a task. Be patient if something takes longer. Modify activities instead of completely eliminating them. Ask before helping. Include the person in conversation and decisions. Celebrate what they can do instead of constantly focus on what they can't do. And remember, helping someone does not always mean doing something for them. Sometimes helping means standing nearby while they do it themselves. Sometimes helping means giving encouragement. It could also mean waiting an extra 5 minutes. And sometimes helping means saying, I know you can do this, and I'm right here if you need me. Caregivers, I want to challenge you today to think about the person you care for. Is there one thing you have started doing for them that they may still be able to do themselves? Maybe today you give a little bit of that independence back. Not because you don't want to help, and not because you don't want to help, but because preserving their independence is a form of caregiving. And if you are the person receiving care, I want you to remember something too. It's okay to say, I would like to try. It's okay to say, please let me do that. And it's okay for you to ask for help when you need it. Receiving help does not automatically mean losing your independence. Sometimes accepting the right kind of support is exactly what allows you to remain independent longer. And that is why companion care can be so valuable. Sometimes a person doesn't need someone to take over in their life, they simply need someone beside them, someone to provide companionship, help with everyday tasks, maybe encourage them, or support their routine, and someone who understands that the goal should be to help them maintain as much dignity, choice, and independence as safely possible. So today's letter is I for independence, and the takeaway for that is simple. Don't automatically ask, what can I do for them? Ask, what can I help them continue doing for themselves? And I would love for you to answer that question here in the comments. What is one way you encourage independence for a person you care for? Your answer may simply be to help another caregiver who is watching. If this video helps you, please like the video, subscribe to the channel, or share it with another caregiver or family member you know. And follow along because we're continuing through the series, The Alphabet and our ABCs of Caregiving. Thank you for spending this time with me. And remember, caregiving can be hard, but you don't have to figure everything out by yourself. We can learn together, prepare together, and make caregiving a simpler task one letter at a time. This video is for educational and informational purposes only. It is not intended to provide medical advice, diagnosis, treatment, and should not replace the advice of your physician or another qualified healthcare professional. Every person and caregiving situation is different, and individual needs may vary. Always consult the appropriate healthcare professional regarding questions or concerns about your specific situation. Thank you so much for watching, and I will see you tomorrow for our next letter in the ABCs of Caregiving. Thank you so much. Have a good night, and remember, a mustard seed is all you need.